Hello, we are Table 14 and we are doing Podcast A.
And today we will be discussing systemic lupus erythematosus, also known as SLE.
SLE is an autoimmune disease where the body will attack its own healthy tissues. Although the cause of SLE is unknown, it may be linked to genetic factors as well as one's environment, hormones, and certain medications. This disease most often occurs between the ages of 15 and 44 and is more common in women than men. African Americans and Asians are affected with the disease more than any other race. Progression of this disease is dependent upon the person. There are episodes of exacerbation and then remission.
The pathophysiology of SLE is that the cells are so severely damaged by triggering factors, it creates apoptosis, where parts of the nucleus, the antigens, are then exposed to the rest of the body, and the susceptible genes cause an immune response and are targeted by the B cells. And then the antigen-antibody complexes are formed. These complexes get into the bloodstream and they stick to the vessel walls of various organs and tissues, such as kidneys, skin, joints, and the heart. The deposited complexes then initiate a local inflammatory reaction, causing damage through the complement system cascade of enzyme activation, leaving cell membranes with channels that allow fluid and molecules to flow in and out freely, causing further destruction and eventually death of healthy cells. So overall, SLE is an autoimmune disease that targets healthy cells and causes an inflammatory response in various organs and tissue.
Lupus signs and symptoms include an inflamed red rash, especially across the face, which appears on the cheeks and over the bridge of the nose in the shape of a butterfly. Mouth sores, leukopenia, clotting disorders, nephritis, pericarditis, Raynaud's phenomenon, which is on exposure to cold, the fingertips may turn white and the person may complain of numbness and tingling. Other symptoms would be pleural effusions, abdominal pain, joint inflammation, myalgia, fever, fatigue, anorexia, and vasculitis. Some CNS symptoms may include psychosis, seizures, migraine headaches, cranial nerve palsies, and peripheral neuropathies. The extreme version and end damage may result in stroke, myocardial infarction, atherosclerosis, renal failure, and pulmonary fibrosis.
Lupus is determined through differential diagnosis. We study signs and symptoms, laboratory values such as the CBC, ESR, we look for elevation, hepatic and renal changes, and anti-nuclear antibody positive titers. We also use imaging to check for major effects on organs. We look at chest x-rays and echocardiograms, and we can also take needle biopsies and skin biopsies to test those as well. We use these tests to rule out other causes of inflammation and tissue damage. Because lupus or SLE manifests similarly to a great number of other diseases and ailments, we use this method of ruling out conditions to diagnose lupus.
This concludes Podcast A on SLE. Thanks.
Bye!